For this Ask Dr. David video, somebody asks, why are so many people expressing concerns about a coronavirus vaccine? Now, there are several concerns that are being raised about the upcoming potential vaccines that are now being researched. The first is that the main type of vaccine that is being developed is using mRNA technology. Now, there's never been any kind of vaccine put forth for coronavirus in the first place, and there's never been an mRNA vaccine that's been released to the masses. And so when new technology is being used, there's also the potential for unintended consequences, the potential for us just not knowing what the outcomes will be that we would know more about if this was technology that had been used already. Now, there has also not been complete transparency during the research phases that we've been hearing about. Most recently, we've been hearing about how the AstraZeneca vaccine was paused due to a significant neurological effect. We have also learned recently that there was an earlier pause in the trial for the same vaccine that we never even heard about. And now we aren't even hearing that much details about what this particular pause is for relative to the types of symptoms that are being seen. So hopefully we will be getting more information about that, but of course transparency is key for us to be able to assess whether we're comfortable doing a vaccine, what the science is going to show us. Now, Operation Warp Speed, which is the term that has been put forth by the federal government to try to put a vaccine out within 4 to 6 months of when they started earlier this year, that brings pause to a lot of people because no vaccine has ever been developed this quickly before. The quickest it's ever been has been for over 4 years, and it can take up to 10 years. Now, I do recognize that with much more money being put in, much more of a concerted national effort, it's certainly possible to speed up a vaccine closer to 4 years. But can we really do it in a 4-month period and have the safety information that we would need in order to make a proper informed decision? Now, there are about 30,000 people being enrolled in any given trial. And there are 330 million Americans. So that means that less than 0.1% of Americans will be part of these studies. And while that's certainly a large number, and most medical research does not have 30,000 subjects involved, there's still the question of what types of circumstances may we have where a person with an atypical autoimmune condition or a hyperinflammatory condition or bad allergies or eczema or hives, how might they react to an immunological stimulant such as a vaccine? And of course, we don't know, especially when it comes to the new technologies that hasn't been tried before. Now, I will continue to monitor this closely. I don't see how at this point I'm going to be able to endorse a vaccine if it's going to be rushed out by the early part of November. I don't see how that it will satisfy my concerns that I can properly make the assessment from a benefit to risk perspective. But for more information, please check out our YouTube channel and our other social media postings as well as our website. Thank you and have a nice day.